Good morning, everyone. Welcome to the second in our series of early bird webinar debates in partnership with Merck Sharp and Dumb. My name is Dwayne Schultes. I'm the Managing Director of Vital Transformation. Thank you very much for joining us this morning. Before we begin, just quickly, if you're having issues with your internet connection, please feel free to switch between the phone and the computer, push the little button next to your mute, and this menu will pop up when we've provided several dozen international phone numbers for you. Please feel free to use the phone. And as well, we definitely want your input. We will be taking questions from the audience. We want your questions, and we will be filtering them through to the panel. So please feel free to submit them as we proceed. Head and neck cancer, while rarely discussed, is extremely common, with more than 650,000 cases and 330,000 deaths a year. These cancers include tumors of the larynx, the throat, the lips, the mouth, nose, and salivary glands. They are cancers you can actually physically see and often include severe disfigurement. As the causes of head and neck cancer are often related to tobacco use, alcohol consumption, and exposure to human papillomavirus, these people often feel stigmatized regardless if their physical appearance has been negatively impacted or not. However, with the recently announced case of throat cancer of actor and director Michael Douglas, the time to move head and neck cancer up from obscurity is now. Why does head and neck cancer occur? How do head and neck cancer patients feel, and why do they feel stigmatized? And what should be done to better treat both the physical and psychological impacts of the disease across Europe? And with that, I am joined by two excellent panelists. First, I'd like to introduce you to Susanna Solis, who's a member of the European Parliament and a member of the group Fighting Cancer. Good morning, Susanna.
Good morning, Dwayne.
And I'm also joined by Chris Curtis, the CEO of the Swallows Patient Group and himself a head and neck cancer survivor. Good morning, Chris.
Good morning, Dwayne. Good morning, Suzanne.
Thank you.
Good morning.
Thank you very much for joining us today. It's a pleasure to have you here. So, Chris, I'd like to begin with you. Can you please tell me how head and neck cancer patients are stigmatized and why they feel that way?
Okay, stigmatized I don't think is a great word, but I'll explain the reasons why, and I may come back to that. It's not a great word because as humans, we are built to eat, drink, and socialize and communicate. When you take that away from someone, we stop being a human being. Then you put in a little bit about disfigurement and the HPV, then you've got a problem with the general public stigmatizing the patients. I don't think patients ever feel stigmatized. I think it's more about the public with a lack of education knowing about the stuff that we go through. They know about breast, they know about all the other cancers, but head and neck is very visual, and suddenly that person changes. And I think that's where the stigmatized comes in.
And Susanna, from your perspective in the European Parliament, I know that there's a cancer plan being rolled out. Are we featuring some types of cancer like lung and breast prioritized? And if so, how are those selections made?
No, in the European Parliament, all cancers are equally important, whether they are very frequent or so-called rare. We do not prioritize one type over another, absolutely not. What does happen is that head and neck cancer lacks the social visibility of many other types of cancer. And we must ask ourselves why. And let's break down the stigma. Let's discuss this cancer. Let's raise awareness and put the spotlight on it. Because if it remains unknown, it can't be prevented. And there is still so much we need to do.
Thank you, Susanna. Now, Chris, from your perspective, can you describe the patient experience of having head and neck cancer as a survivor yourself?
Yeah, I've spoken to a lot of cancer patients, both head and neck and all the other cancers. And there's no real common factor apart from with head and neck. When you get diagnosed with head and neck cancer, your whole body is handed over to somebody else, literally. That person then, the health professional, takes control of your body. He or she decides on your treatment pathway, what's going to happen, when you're going to happen to it. And it's brutal. The actual experience of a head and neck patient, because it affects everything that is from shoulders upwards, radiotherapy, 60 days of radiotherapy every day, chemotherapy every day for 6 weeks, neck dissections, disfigurement, that is all taken away from you and they decide on your outcomes. The problem is the outcomes are not fantastic. You know, yes, they cure cancer, and thank God they are curing cancer. Never want them stopping doing that. But, you know, survivorship is not survivorship without quality of life. And quality of life for head and neck patients post-treatment is one of the worst of the cancers. We are in the top 3 for suicides, and no one takes that seriously. And that's all down to the treatment. It's all down to being isolated. It's all down to everything else that goes on with your body. I lost half my body weight. I wasn't the person I started when I started my treatment. You know, I'm a pretty confident guy. I couldn't even talk to my wife because of no confidence through my treatment. That's what happens to a head and neck patient. Because like I said before, take the ability to eat and drink and communicate off somebody, then you have a problem. And it has a massive knock-on effect. But the good news is that 5 years, majority of us, they give you the good news, you've survived cancer, now move on. How do you turn that light bulb back on?
How long was the period between your diagnosis to recovery? How long was that actual process for you?
Almost 3.5 years. I didn't eat for 3 years or drink for 3 years.
So what was it, through a feeding tube then? Is that how you were?
I was through a feeding tube for 3 years.
And you're in remission now and everything's going well?
Touch wood, you know, I live for today. I'll generally go to bed tonight, and I've never met anybody in this world that wakes up tomorrow. So
Yeah.
I live for today. And as long as I can look in the mirror tonight and say I've done the best I can for today, then that's my day finished.
Thank you, Chris. Susanna, it was announced on June 18th that the European Parliament had set up a committee to work on a cancer master plan. What's the objective of that plan, and is head and neck cancer included?
Thank you, Duane. First of all, thank you, Chris, because I was so touched when I heard your story. It is crucial that the European institutions put the focus on this fight. And I am very much welcome the proposal of the European Beating Cancer Plan presented by the Commission, but I would also like to emphasize the active role that the European Parliament is having through associations like MEPS Against Cancer and the Challenge Cancer Intergroup launched last week. And I am honored to be part of both groups. And without doubt, we will discuss and give visibility to the head and neck cancer. You have my commitment. But there's more. As you mentioned, Duane, a special temporary committee on cancer was also approved at the last plenary session in the Parliament. And for 1 year, we will evaluate concrete measures, legislative or otherwise, to prevent and combat cancer and to promote research. And it does not highlight any particular cancer type. In fact, the approach of this committee is considering all stages of the disease: prevention, diagnosis, treatment, quality of life of cancer survivors, and palliative care. And of course, to ensure a close link with the cancer research mission of the Horizon Europe program, which will be key to advancing cancer research and developing state-of-the-art treatments.
Thank you. I'd also like to point out to our audience that we will be taking questions from the audience. We very much appreciate your input. You have a Q&A button. Please feel free to push on that button, submit a question, and I will happily present them to Susanna and Chris. Thank you very much. We look forward to having them. Chris, given your personal experience, what do you recommend be done at the local, national, as well as the pan-European level to combat cancer such as head and neck? What do you think should be done better?
I think it's pretty easy that. One, we've got to start with quality of life. That is a must. It's my drum. It's one I keep banging away at. But I think also it's the awareness. You know, Susanna just said an awful lot of things there, but I missed the word awareness. Awareness starts the pathway. And I think when you're looking at pathways, unfortunately, health professionals look at pathways from the minute you get diagnosed. If you haven't got the awareness and you haven't got the ability to get them to that health professional, then we are missing opportunities to save lives. So awareness is one of the most important parts that any organization, any authority, any decision maker, anybody that's out there with money should be looking at making sure we've got awareness for head and neck exactly the same as breast and pancreatic and bowel cancer has. This is one of the fastest growing cancers in the world. Yet there is no awareness on TV, there is no awareness on radio. The only awareness that happens is what we do on a global basis. 27th of July this year is World Head and Neck Cancer Day. So last year we had 2.2 million people in 24 hours on Twitter following World Head and Neck Cancer Day. And then it just dies off. It's a bit like patients. You get that diagnosis or you get it and then everything goes quiet. We have to create awareness. And the thing I would like to do is challenge Susanna to take that back to Parliament and get some awareness programs going. It needed worldwide, not just Europe.
Chris, are there any awareness programs? Are you running anything locally in the UK where you're based, or how do you recommend starting that if patients are interested out in the listing in the public?
We run an awareness program, so we have videos, we have posters, we put them in libraries, we put them in doctor surgeries, we put them in hospitals, we put them in dentists, we put them in schools. And that's not just in the UK, we send them out globally in different languages. The hard bit is getting people to contact us and say, we need some of these and help us support it to get them printed. But there's already a program to get the awareness there. All I need are platforms to deliver it on.
How's been the feedback when you've approached people? Are they aware of the head and neck cancer as an issue, or have you had, are people generally receptive to listening and willing to help?
I would say some are, some aren't. But once I get someone face to face, I make them listen because this has to happen. And then once they hear my story of why it's happening, then they understand it. Or you might find someone that actually knows someone who's had it in it. And then that's completely different. They are then really turned on to helping and support it. But, you know, I still think there's that, going back to that stigma, there's that thing of, well, it happens to people over 50. Majority is male. They must have bought it on themselves because they're smokers and drinkers. I never smoked, I never drank, but I got HPV. And that's the problem with the stigma as well. So
sure,
campaigns have got to happen.
Thank you, Chris. Now, Susanna, you've heard Chris's perspective. How do you think we can align those priorities for awareness and get the drag down into the member states where the real work has to be done? How can the Parliament and the Commission actually get that down into the grassroots level in the health administrations and the health ministries where this needs to occur?
Yes, I strongly believe that we should all tackle awareness jointly. We must remember that the EU does not have competencies on healthcare systems in the member states, but this beating cancer plan could lead the way to a better coordinated approach from the member states to the fight cancer. And there are two actions that we could take at European level. First is research. It is essential to have a strong budget to support research, to strengthen prevention, diagnosis, treatment, and innovation. And the second one is awareness. We can play a key role here, and this is why in the European Parliament, we are working on this group, Mex Against Cancer, and the cancer intergroup. This is only with the aim to raise awareness. And then we have to also work in the equity and access to treatment, reducing inequalities, not just between member states, but also within member states, and also, for example, to work on vaccination. And the thing is, I heard the Chris story, and I would like to make sure that this model that is being successful in the UK works also in other countries, and we raise awareness in other countries. This is my main issue, is how to translate the successful and the best practices in some member states to other member states.
Susanna, one of the things that we're seeing is there's a European cancer plan, there's a Parliament cancer plan. How are you aligning, making sure that those are aligned between the two institutions? I mean, it's only, what, 150 meters, but how do we make sure that you're all working together?
No, we work together. In the presentation of the beating cancer plans, the intergroup and the association was present, and we are just working together on concrete actions, and we are feeding the Commission proposal with measures and with ideas, ideas and giving visibility. And we are we are joined and we work together, that's for sure. It's just, we need more and more actions, and it's good if we can raise more visibility to cancer, but it is a joint action.
Thank you, Susanna. Chris, you mentioned something that was quite interesting, and I think it's important we pick up on. Head and neck cancer is often seen or stigmatized because it's seen as, like you mentioned, smoking, drinking. Are you at all concerned that due to what's been happening with COVID-19, that with joblessness and the rise of unemployment, that we're going to see more impacts of this disease over time? I mean, we know that the data is showing there's a huge increase in alcohol consumption, for example, due to unemployment. What's your opinion on that?
I think, again, yes, there's going to be an increase, because certainly the thing with smoking and drinking is it's not so much creating the cancer, it's affecting your survivorship rate. So if you're a non-smoker and non-drinker and get cancer, you've got a better survivorship rate. If you smoke and drink and get cancer, your survivorship rate is a lot less. So the ability to get the cancer doesn't really matter whether you've got it or you haven't got it, because if you've got HPV, you're going to get that cancer. So I think there has to be a define between the two. So if you're HPV, then you've got to have the education. If you smoke, your survivorship is going to be a lot less than mine, down to about 50%. If you don't smoke and don't drink, then it's up to, in the UK, about 90%. Which one do you want?
Yeah.
If you're a gambling man, carry on drinking. If you're not a gambling man, stop drinking and smoking. It's as simple as that. But the ability to get this cancer, if you get it through drinking and smoking and not HPV, that's a different way of getting the cancer. So again, it's around awareness. What you're saying to me, Dwayne, is the normal thing that people think. And even you're thinking, well, if there's drinking and smoking, the cancer's going to increase. That's not going to stop people drinking and smoking. What's going to stop them doing it is the ability to live when you've got the cancer. That's the important message. So which one do you want? Stop drinking, stop smoking, 90% survivorship. Drink and smoke, 45, 50%. Your choice, it's your body.
Yeah.
That's the message.
Thank you, Chris. Susanna, to you, we've got a question here that's come in from someone who's anonymous. Thank you for the question. Picking up on what Chris just said, do you think there's a risk that the impact of COVID-19 and budgetary impact in particular will negatively impact the work you folks are trying to do on cancer? And if we look at Spain and Italy from the IMF's projection, the loss per month in GDP alone is 50 billion,
Yes.
50 billion euros a month. So you're looking at potentially 125, 130 billion in lost revenue for each country. What do you think is going to happen from the standpoint of what you want to do and what you're going to be able to do fiscally?
Yeah, it is a big concern because, as you mentioned, the pandemic has hit the European economy hard, but not equally across all countries and sectors. We are facing, for example, in Spain, a massive increase in unemployment. And in these desperate times, people might turn to alcohol or smoking because of psychological distress. And this is exactly these habits that are the principal causes of head and neck cancer. So for us, fighting cancer is about fighting also the underlying causes of it. And I think that raising awareness of link between harmful habits such as excessive alcohol consumption, of smoking and cancer, it is crucial, of crucial importance. And fighting cancer is also about tackling social measures to address the needs of patients and caregivers and to improve their rights to non-discrimination and also to employment, of course.
Of course.
We need to work on it. So the social impact will be huge, and we will need to focus on this in the European Parliament. It's one of our objectives.
From the conversations you've been having back home in the member state, I mean, do you see alignment between what's going on in the Ministry of Health in Madrid and what's being discussed here in Europe about the idea of investing in cancer prevention? We're seeing this in Germany. We're seeing this in many countries. I mean, do you see traction for this, Susanna, locally?
I see there is a willing of coordination, but we still lack coordination. And as I mentioned before, there are inequalities with the member states. And that is something we need to tackle because there are huge inequalities, not only within member states, also within regions, in access to treatments, for example, or prevention, or even access to vaccination. For example, in the UK, Chris was telling me that boys are vaccinated, while in other countries it is not the case. So we need to work on inequalities, and there is a willing, and I think this is the aim of the Beating Cancer Plan, to coordinate all efforts.
Again, I wish people would be putting their names, but someone's anonymous here, but I like the question. This is a question for Chris. Now is your chance to speak to an MEP. What would you like to ask Susanna to do in the European Parliament for head and neck cancer? Here you go, publicly on record. What do you want to say, Chris? Go ahead, the floor is yours.
What I would say is we met through another one of these, myself and Susanna, and within a couple of days, she'd contacted me to make contact with me. So I think we've got an ally on our side rather than an enemy, which was the first thing. I think we've said an awful lot today, and the challenge I would like to say is you need to go back and realize when you are writing these platforms and the pathways, no matter what cancer it is, the pathway starts with awareness and it doesn't finish until death. Don't keep looking at pathways from the moment you get diagnosed when you get told you've finished with cancer. That is the medical pathway. That is not a patient's pathway. And also, please start using real patients that can give you the input, because we've lived it, we're the experts, nobody else. A medical person goes to college for it, an education. I didn't have to go to college or pass a university degree to understand head and neck cancer the way I do. So start using us in building pathways and journeys. They will be far better and more reliable. And when the next wave of patients come through, they will understand that it's been written and designed with the help of patients. That's what I would send the challenge on. Start using us.
Thank you, Chris. Now, Susanna, what do you do when you hear feedback from someone like Chris? How does that work? Does that help you? And how do you harness that in the Parliament?
Yes, it has helped me a lot. Not only the testimony, and he led me now to know the disease, but also to get in contact with patient associations in Spain and other countries to really get to know what we need. And the first time I met Chris, I told him it was a gift, because it was a gift for me to understand what this cancer means, and he has my commitment, and I would like to show you my commitment to help head and neck patients in the Parliament during this mandate, to raise awareness and to make this cancer as well known as any other cancer, like breast cancer. So this is my commitment, and I wanted to thank Chris for helping me now this disease.
Thank you. And again, picking up on that, Chris, for you, here's another question. As a head and neck cancer patient, do you feel that your voice is heard by decision makers, or is the space often too crowded with breast, prostate, etc., that are slightly more high profile? How do you think you team up with industry or other organizations to help patients get more leverage and a better voice?
I think you're right. It is a very crowded space, and whether we like it or not, breast and all the other cancers, the top four, get all the exposure. The problem is, I could wheel out a sick man with head and neck cancer in a room, and people would just look. You wheel out a sick mother with breast cancer with 2 children with her, and money pours out of people's pockets. Yet it's the same. I still have children. Yet the breast cancer, they can wheel the children out with them. And I think there's that. The government, the only way you can hit government and hit them hard is by literally being in their faces. So the way we got our vaccines for boys is that 2 or 3 charities got together and threatened to sue them for equality. If you give something to a boy and you don't give it to a girl, or a girl and not a boy, that's an equality issue, nothing to do with the vaccine. So we were going to sue them for equality, and we proved that there was an equality, and they had to back off then because they had no argument. That's why our boys got vaccinated. But it took us 5 years of battling. Government do not want to listen to head and neck because it is not a vote winner today. Breast cancer is a vote winner today.
That's a really interesting point, because if you look back at the history of breast cancer treatment, NICE had rejected, in a very famous incident about 10 years ago, a breast cancer drug. And then there was a political action group that formed, and women are 51% of voters. Do you think that it's really just men don't organize in groups as well as the women have around breast cancer? Do you think it's really just an issue of a men's rights issue in many ways, Chris?
I think 90% of head and neck is male. But like I say, a lot of those head and neck patients lose their confidence, so they're not in the place to battle. When you are battling as a breast cancer and you've got children that rely on, women are a lot stronger. It's known that men are softies. I certainly was a softie when I got ill. Women aren't softies. Women, if they've got to protect their children, naturally will come out and fight. Men don't. And I think that's one of the issues, Dwayne, is that once you get in a place to fight, then men are brilliant. And I've got voices all over the world that are fighting. But when I need them to fight, they're not in the place to fight.
Right.
Because when they're in the place of treatment, looking their worst, that's the bit that gets people to say, oh, we need to do something. When I'm looking like I am now, unless you knew I had cancer, you wouldn't think there was anything wrong with me. Yeah, I still, 9 years on, have issues, and I take 5 or 6 tablets a day. And that's one of the issues. When you look at me now, there's nothing wrong with me. But I don't know what goes on behind the scenes.
Right.
That's the issue we have with head and neck.
Well, I mean, we'd love to go for another hour, and I'm sure we could. Unfortunately, believe it or not, ladies and gentlemen, we're almost out of time. It's been an amazingly quick half hour. Thank you both. I do have one final question for both of you. Susanna, I'd like to start with you. If you had one objective that you could deliver, from a standpoint of industry policymakers, healthcare practitioners, and patient associations, what one thing do you think we need to focus on the next 2 years to prevent head and neck cancer? What's the one thing you'd like to deliver?
I strongly believe that we need to work hard all together, industry, policymakers, healthcare professionals, patient associations, to give more visibility to head and neck cancer. Because raising awareness will make people more aware of the dangers of alcohol and smoking, will strengthen the need for vaccination, will mean more funding for prevention campaigns and early diagnosis, more funds for research and state-of-the-art treatments. So raising awareness will save lives. And my question is, what are we waiting for to start acting now? Because I think together we can make it. We can prevent the disease and improve the quality of lives of thousands of patients and carers. And this is my commitment today for all of you, to explore any possibility in the European Parliament to start taking action on this. And there is no time to waste. We want to stop until this cancer is as well known as breast cancer. And I just wanted to thank Chris for inspiring us with his story, for his courage, his bravery, which is pushing me to act and to take part in this. It was a gift to have met you, and many thanks. I hope to see you soon.
Thank you very much, Susanna. And Chris, the same question to you, sir. What one thing would you like to deliver in the next 2 years? Where do we think we get the most bang for the buck?
I don't want 2 years, I want 1 year.
1 year.
2 years is too far.
You got a year. Fire away, sir.
So I'm going to go for 1 year. Within 1 year, I want to see an awareness program linked to screening, then linked to early diagnosis. So I want that early link. So there's the 3 stages: awareness, screening, and then early diagnosis. The UK has that in here, and it saves lives. So I want to see that global. But I also want people to start to understand the cost of quality of life post-treatment. Because in survivorship, once you go from survivorship to quality of life, that is somebody else's budget. If we can actually put a physical amount of money, what it's costing for quality of life, when it goes in front, drugs go in front of NICE, new treatments go in front of life, the qualities will actually go to death, which means then drugs then should go through a lot easier and a lot more smoother. But at the moment, they stop their qualities at the point that you get survivorship. And I think that's why we need to understand. So that would be my commitment for 12 months. By this time next year, I'd love to see that in place. And it would certainly, A, save lives and make a patient's journey a lot smoother. And that comes, the support then is needed by everybody. We have to become one voice. We have to become one family. Anybody that is on this call today has an interest in head and neck. So as far as I'm concerned, they are part of our family. Being part of a family, you protect us. Start protecting us and our next generation of our family.
Thank you very much, Chris. And I'm sure you're aware, or maybe you're not, that there are several governments that are moving away from quality to comparative effectiveness. So those things are starting to happen. So Chris, thank you very much. Susanna, thank you very much.
Thank you.
And for the audience that was on, thank you very much. Unfortunately, we're now closed, but thank you all for your participation, and I look forward to seeing you again. Good morning,
Thank you.
everyone. Bye.
Thank you.